Hello everyone, once again welcome to my Oet channel. Today I came with an Oet exam introspection. So the exam date is 11th March 2023. So anyway, we will see the writing introspection first, then we will go to the speaking. Anyway, this time also they asked noun case. This letter was directed to, it is addressed to patient's family doctor. So the last time also they asked the same reader. Anyway, the content was very less. Actually, the students, they got difficulty to write the present medical paragraph because once it is a non-case, of course we will not have more things to write. And especially in this letter they have given many visits, many patients visits to doctor's clinic, but this everything it's already known by the doctor, so we could not write every visits and all. Actually, there is no logic to write all these visits and all, but there is only one visit, the last the home visit. It was not known by the doctor, so that is the content. Only the content we have to write it in our letter. Anyway, just we will see the scenario, then it will be clear for you. And at the end I will show you and I will explain you the sample letter also, so see until the end. So this as usual, the date is 8 January 2023, and this patient is a female patient. Patient's name is Mrs. Kathleen Selnick. She is 71 years old, and she is recovering from total knee replacement surgery. She has undergone the surgery successfully on 27 December 2022, and during hospitalization she was compliant with physiotherapy, exercises, mobilization, everything. So her progress was good. Gradually she got discharged with the arrangement of our home visit. We are the district nurse, and we are the person going daily for wound dressing post-operatively after discharge. So thereafter they have given many visits, and in these visits and all they have mentioned that we noticed that her mobilization is decreasing. She is very reluctant to mobilize. She is not compliant with the physiotherapy and the diet, everything. And gradually she has visit to the consultation with the family doctor. So she's explained, the doctor has explained the importance of mobilization and regarding the medication, diet, everything. Then gradually in another one more visit, it's noted that her wound became infected, surgical wound became infected. So that again there is family's doctor consultation, and she has been initiated with antibiotics. So now the antibiotic is ongoing. Then during another one more visit, they have mentioned that she has low mood. It's supposed to be depression. So again the son is concerned about her low mood, and there was another one more consultation with the family doctor, so that she has been initiated with the citalopram for depression. So these all things, it's happened and it's already known by the doctor. So we could not write each and everything. Like we can concise and we can write it within 1 or 2 sentences. That is the only thing we can do with the phrase as you are aware. Okay, so one thing I had to tell you now, if you got one known case and if you want to write something old history which is already known by the reader, don't forget to use the phrase as you are aware. Okay, so if you are using that word, it will be like a reminder for the doctor. It will not be like a unknown case. So it will be easy for you to score B-score if you are, even if you are writing the old history also. But don't write more old history in the present medical paragraph. Okay. Then that is all old visit, the concise information. And today's visit, actually when we observe the patient, she's noted with still there is no improvement in her mood. Moreover, her physical mobility is very decreased. So we are just writing the letter for further assessment and request community physiotherapy visit. Okay, that is a community physiotherapy. That means through home visit they will provide the physiotherapy. So this is what we are requesting in the recommendation. Moreover, there is another one more request to review her antidepressant medication, because still she doesn't have any improvement in her mood. So these two are our recommendation. And as you know that this is a non-case letter, we could not include any social paragraph, only present medical paragraph and recommendation paragraph. We have to write something like a bulk words were count. An introduction, of course, it will be there. So this is the overall content of this letter. So she is recovering from total knee replacement surgery. During hospitalization, she was compliant with the physical mobility and exercises, but thereafter she started to reluctant with this mobility and physiotherapy sections because of her low mood. Anyway, upon discharge, already our visit has been initiated, and daily we are going for the wound dressing. During this home stay, she has developed infection, so that already antibiotic is on flow, and already she has the signs and symptoms of depression, so already citalopram is ongoing, as well as her mobility is decreasing. So already doctor has explained regarding the importance of this mobility, everything. But today's visit, everything it is same. She is not compliant with this physiotherapy exercises, and her mood is still same. So we want to write the letter to the family doctor, to her family doctor, regarding her condition, and we are requesting to arrange family community, that is not family, community physiotherapy sections, as well as review of her antidepressant medication. So this is the overall idea. So now I will tell you the sample letter. So I am not sure regarding all the content. I hope these all are the content of this exam. If there is any changes, you can comment in the comment box, so that when I am doing the fair letter, I can make the adjustments, or I can make the correction. Okay, so anyway, the sample letter will be like this, I hope. So the date is 8 January 2023, and we can write the if it is given doctors, if the doctor's name is and address is given, you can write the same, but I am not sure about his name and all. Anyway, I just mentioned here is like, dear doctor. Then regarding Mrs. Kathleen Selnick, aged 71. The introduction. So in introduction, we have to write about it's like updating letter. Of course, we are requesting some assessment and further management for her low mood, and regarding this mobility issues also. So we can write like this: I am writing to update you the current health status of Mrs. Kathleen Selnick, who has low mood and is recovering from total knee replacement surgery, because we have prioritization for both these cases. That means low mood as well as the knee problem, because still her mobility her mobility is not normal, became not normal. So I am writing to update you the current health status of Mrs. Kathleen Selnick, who has low mood and is recovering from total knee replacement surgery. She requires further assessment and management. So that's enough. Then we can go to the present medical paragraph. As I told you, if you want to write only today's scenario, the letter will be very less. You could not complete the requirement of 180 words. So you can just write something old history, but you have to mention, or you have to start with as you are aware. So you can start like this: as you are aware, comma, on 27 December 2022, Mrs. Selnick has undergone the surgery successfully. That's enough. Okay, the surgery, no need to mention again the surgery's name, successfully. And since discharge, she has been under my nursing service for regular wound dressing. So that is a lengthy sentence you can make, but you can cover many points. Okay, as you are aware, on 27 December 2022, Mrs. Selnick has undergone the surgery successfully, and since discharge, she has been under my nursing service for regular wound dressing. Okay, or daily wound dressing. And then you can write like this: currently, comma, she is on treatment with antibiotics for her wound infection, and citalopram for her depression. So this one also a concised form. No need to mention that in between she showed these symptoms and already the consultation is over, already the medication is started. Nothing. No need. We can just concise and can write currently she is on treatment currently she is on treatment with antibiotics for her wound infection and citalopram for her depression. With this sentence, we have to conclude that paragraph. Okay, this is old things, and we just concised and we just remind the doctor. That's enough. Next paragraph you can write as a continuation of present medical paragraph, that is today's visit. What are things you have noticed during today's visit? So today's home visit, comma, Mrs. Selnick is found to have less mobilization and non-compliance with the physiotherapy exercises. Okay, so today's home visit, Mrs. Selnick is found to have less mobilization and non-compliance with the physiotherapy exercises. Also, comma, she has no improvement in her mood, and she is non-compliant with the antidepressant medications. Okay, so this is related to the current mood. So also she has no improvement in her mood and has no non-compliant, and she is non-compliant with the antidepressant medication. Therefore, this is a conclusion sentence. In every letter, I recommend you to write this conclusion sentence. It's a simple sentence you can make very easily, but it will make your letter unique. Okay, so you can write like this. Therefore, further attention from your expertise service is essential for her well-being. So that's enough. Okay, so this is a present medical paragraph. Everybody will get difficulty in writing this present medical paragraph, I know, but you can just think logically. You can think it is a known case, so no need to write about all the history in a large paragraph. You can just concise and you can just summarize. And but today's visit is important. What all things you have noticed, you have to mention here. Then we can go to the recommendation paragraph. As you know that in present, there is no social paragraph or known case. You can directly go to the recommendation paragraph. So it would be appreciated if you could take over the case of Mrs. Selnick to review her antidepressant medication and refer her to a physiotherapist for community physiotherapy sections to improve her mobility. So this is a simple sentence. We can conclude both recommendations. We have only two recommendations. One is for the review of medication and another one is for physiotherapy services. So it would be appreciated if you could take over the case of Mrs. Selnick to review her antidepressant medication and refer her to a physiotherapist for community physiotherapy sections to improve her mobility. That's enough. Then the conclusion sentence will be, please do not hesitate to contact with me if you have further queries. Yours faithfully. As I don't know doctor's name, I'm writing yours faithfully. If there is doctor's name, you can write yours sincerely. Then district nurse. So I hope it is clear for you. Once again, I will read for you. So we will write the date, age January 2023, and the address, given address. Dear doctor, regarding Mrs. Kathleen Selnick, age 71, I am writing to update you the current health status of Mrs. Kathleen Selnick, who has low mood and is recovering from total knee replacement surgery. She requires further assessment and management. As you are aware, on 27 December 2022, Mrs. Selnick has undergone the surgery successfully, and since discharge, she has been under my nursing service for regular wound dressing. Currently, she is on treatment for with antibiotics for her wound infection and citalopram for her depression. The next paragraph, today's home visit, Mrs. Selnick is found to have less mobilization and non-compliant with the physiotherapy exercises. Also, she has no improvement in her mood and non-compliant with antidepressant. Therefore, further attention from your expertise service is essential for her well-being. Then it would be appreciated if you could take over the case of Mrs. Selnick to review her antidepressant medication and refer her to a physiotherapist for community physiotherapy sections to improve her mobility. Please do not hesitate to contact with me if you need any or if you have any queries. And yours faithfully, district nurse. So this is the content of our letter. I hope it is clear for you. Then we will move to the speaking introspection. Actually, I got 5 topics. So these 5 topics include, the first one, it is punch biopsy. In this scenario, a 27 years old female patient is seeking explanation regarding the punch biopsy in her right leg. So of course there will be one scenario with procedure. So it includes the definition, simple definition, what is the procedure involves, pre-procedure, and what is exactly the procedure, and after care, what all things they have to avoid, what is the indication, this everything we have to explain. And the next scenario is 5 years old baby with jaundice. So she is in baby clinic and we are talking to the parent, and as you know that it is a second degree talk, it will be very difficult for you if you are not giving attention, because you are talking to a third person. So you have to maintain that relationship always. It is for somebody, you are talking to somebody. Okay, so it is related to jaundice. So mother has many concern regarding the jaundice, how it's happened. because within 5 days how the baby developed this jaundice, maybe because of her fault or whether she didn't take care. So these concerns, it will be there. You have to give more reassurance in this type of role plays. And the third one is post-operative patient affected with the conjunctivitis. So actually they have given, it's like a known case, like you have just examined like that. So of course in this case, regarding conjunctivitis, you can give more information. What are things she has to take care, what are things she has to avoid, and what are the things she has to take care to prevent further conjunctivitis. These are all the things may be expected questions there. And the next one is knee replacement surgery. After knee replacement surgery, patient is experiencing nausea and vomiting or something like that, and we are offering injection as per the doctor's order, but she is refusing. The patient requested for oral tablet. So in this case, we have to explain regarding the benefit of injection, regarding the fast absorption and fast recovery. If oral means already she has nausea and vomiting and she could not take the tablet form. So this everything will come in that. Yeah, the last role play is post eardrum surgery. So it is also related to a baby. And after the surgery, this is a discharge discussion. So this one also a sure question for all Oet exam. So you will discuss the discharge procedure to a patient or to a parent. Okay, so here after the surgery, ear surgery, what are things they have to take care after going home. So what are things they have to avoid for the baby, and what are things is allowed. So regarding this everything, it will be there. So these are all the speaking tasks which came for the exam. So as in a general, if we are talking regarding speaking, there will be, of course, you will get one home visit. Actually I didn't get remaining questions and all. Anyway, there will be one home visit, and another one is a non-scenario, like already you have examined or just now you have examined, like that it will come. One hospitalized patient scenario will be there, and another one, it is for procedure. You are explaining any procedure or any surgery. And another one, there will be a talk, secondary talk. You are talking to a parent. So these are the common questions you can expect. And sometimes there will be immunization also, mostly baby's immunization or adult immunization will be there. So these are all the questions are expected in every Oet speaking cards and all. There will be mostly 8 or 9, I'm not sure about that, but mostly they will cover all these type of questions. So always when you practice and prioritize these questions and all. Okay, if you go to my Telegram and if you search in the file section, I have uploaded many speaking role play cards, like recently asked role play cards and all, and even 2020 role play cards. You can what are the cards they have already asked in the year 2020, because these cards, the same card can be come during the upcoming exam also. Sometimes it can come the same card, so it will be easy for, if you practice those cards, means it will be easy for you to present during your exam. At least you will have an idea how will be the presentation, how to start, how to conclude, what are the connectives you have to use, these things and all. If you practice, you will get easily. And always try to practice with someone. Okay, at least through the phone, at least with your friend, or through the Telegram, or your roommates or classmates. I mean, through the hospital. I mean, those who are working along with you, the colleagues. Because practice is very much important in speaking. If you didn't practice, of course, you will lose the confidence. If you lose the confidence, of course, there will be long gap, so it will affect your mark. So try to do many role play cards with your friends, so that it will give you the confidence. If you do minimum 50 cards, means of course you will be confident enough to handle any question papers. Okay, anyway, they will ask you repeatedly, they will ask the same type of question. Actually the condition will be different, but the type of questions will be more or less it will be same. And regarding the letter, so if you follow my playlist, if you can open my YouTube channel and if you see the playlist, there will be more questions are there with the sample letters. And there are one separate folder, like OET, it is a common tips. So if you open, you can see only the tips, what all the common tips and upgrade, updates, what all the things you have to take care when writing each and every type of letters you can see. And I have given with this different headings like occupational therapist, physiotherapist, social worker, and urgent letter to the nursing reader, and letter to the doctors as a reader, and non-medical like CEO, manager, these letters also. And even non-case, there will be different folder. So if you see the playlist, it will be easy for you to study. And if you are a beginner, I suggest you to go to my writing. Only there is one separate folder, separate playlist. It is only for writing. So if you go in that letters, you can see the basic. Starting will be from the basic and type of letter, each letter how to write the introduction, present medical paragraph, social paragraph, recommendation paragraph, known case, like one by one I have explained. So it will be easy for you to learn, I hope. So please make use all resources which is available in YouTube and Google and all. You have vast resources are available nowadays in our social media. So everything you can utilize properly. Okay, organize your study material and learn it properly. So of course your exam will be very easy if you practice. So before taking the exam date, make sure that you are confident enough to face the exam. And if you have any queries, you can just message me in the Telegram or else in the YouTube. If you message in the Telegram, it will be easy to answer there, with even with the audio, or if there is any presentation or anything, it will be easy. So the link, everything I have given in the description. You can see the link of my Telegram, and specific headings also I have given in the description. And if you click, you can go directly to the playlist. Anyway, we will see with another one informative video. Until then, bye. Take care.